Hello, everyone. My name is Kim Frank, and thank you for viewing my virtual poster presentation. Today, I'm presenting on my capstone, which examines the use of sensory-based interventions for children with histories of complex developmental trauma. I completed this capstone through Ohio State University's Doctorate of Occupational Therapy program under the guidance of Lindy Weaver. To gather evidence in this area, I completed a scoping review to answer the question, what is the extent of sensory-based interventions within the literature to treat children and adolescents who have experienced complex trauma? Youth who have experienced trauma require a unique approach to treatment that specifically targets the impact that trauma has had on their brain development. As you can see in Figure 1, children who have experienced toxic stress as a result of trauma have significant alterations on their brain in comparison to a healthy brain, furthering the need for a unique approach to treatment. Bottom-up approaches such as sensory-based interventions have been found to help target trauma-related symptoms, such as dysregulation and maladaptive behaviors, which hinder their participation in their daily life. A broad search of the literature was completed in accordance to the preferred reporting items of scoping review to identify key sensory-based interventions for youth who have experienced complex trauma. The original search string populated 709 studies, which were then narrowed down based off of inclusion and exclusion criteria. Studies were included if they incorporated sensory-based interventions, were published between 2000 and 2020, and included children and adolescents under the age of 18 who had a history of complex trauma, developmental trauma, or trauma-related symptoms. Studies were excluded if the source did not include the participant's diagnosis of trauma, or if they were published in any other language than English, or if they were a systematic or scoping review. From this literature search, 3 common themes and accompanying sub-themes emerged: the use of individualized interventions, environmental interventions, and occupation-based interventions. Under individualized interventions, the use of sensory diets, incorporation of the caregiver, and other direct OT-based interventions, such as the use of area sensory integration, were commonly seen. Common environmental interventions within the literature included use of a sensory room and use of therapeutic classrooms. And finally, under the occupation-based interventions, the use of drawing, play-based interventions, and sensory motor activities were all frequently identified. These results from the 10 studies indicate that sensory-based interventions were effective at reducing trauma-related symptoms, such as decreased self-regulation or increased use of maladaptive behaviors when utilized as part of a larger multidisciplinary approach. Knowledge gaps identified within the literature included a lack of evaluation of one specific sensory-based intervention apart from a larger intervention approach, along with an overall weak body of evidence. These gaps just further the need for additional high-quality studies to be concluded. I had the amazing opportunity to translate the evidence from the literature into practice at Back-to-Back Cincinnati as my capstone site. Back-to-Back is an international nonprofit organization that strives to love and care for orphaned and vulnerable children. Everything they do is surrounded around their 5-point child developmental plan, which strives to meet their spiritual, physical, educational, emotional, and social needs. At the Cincinnati location where I was at, they serve a diverse, largely low SES population of underserved children and their families. They do this through partnering with other organizations in the Cincinnati area to provide tutoring, mentoring, coaching, and other programming, such as Play with a Purpose and in-school nurture groups. During my time there, my role as a doctoral student was to implement sensory-based interventions with children to assist in developing self-regulation skills needed to maximize meaningful participation in their daily occupations. I was also able to address developmental and sensory-related concerns by providing education and resources to staff. I also got the opportunity to provide occupational therapy-specific recommendations for improvement in various programming, along with advocating for the provision of OT. My primary objective while on-site at Back-to-Back was to translate this evidence into practice. I did this through implementing an evidence-based, sensory-based interventions within an individual case study for a child with a history of trauma. Prior to arriving on site, multiple conversations took place with the site mentor to assess feasibility, acceptability, and appropriateness of the intervention, along with identifying knowledge gaps and available funding and resources. After integration on site, a child was identified for intervention through observation and discussion with staff. The child chosen for the case study was a 9-year-old boy with a history of abuse and neglect. He had presented with a pattern of behavioral dysregulation and non-compliance within the home and community setting, frequently leading him to getting kicked out of daycare settings and impacting his social participation and play as a whole. Goals were created around decreasing maladaptive behaviors and increasing the use of self-regulation techniques. On the right of the screen, you'll see a general overview of the intervention implementation. I started with the sensory profile 2 to capture his sensory needs throughout the daily routine. Through discussion with staff on site, along with results from this assessment, interventions were then created and implemented within the existing programming that the child was already participating in on site. Examples of some interventions I used included direct education of sensory-based regulation techniques, implementing a modified sensory diet, use of items within the sensory corner, incorporation of sensory motor activities, and education to staff on ways to best meet his sensory needs. Throughout the 4 weeks, changes in targeted maladaptive behaviors were tracked, along with tracking his use of self-regulation techniques. An interview was also conducted with staff to assess their views and perceptions on the interventions as well. At the end of the 4 weeks, there was a 48% average decrease in these maladaptive behaviors seen during programming, along with the 4.5 times increase in independent use of self-regulation techniques. Interviews also confirmed these results in stating a positive perception of the interventions due to his increased self-regulation, and it helped him build his self-confidence. Strategies that I provided back-to-back for continued implementation and sustainability included staff education and accountability, trauma competent care advocacy within an OT lens, increasing interdisciplinary collaboration, and increased resources. In conclusion, this case study furthered the notion that sensory-based interventions can elicit positive outcomes for children with histories of trauma. Occupational therapy has the potential to play a key role in utilizing this treatment approach to mitigate further marginalization of this already vulnerable population. And lastly, while I was on site, I got the opportunity to collaborate with staff and complete additional projects and learn from others. One of these projects was assistance in building a sensory-friendly classroom. I was able to collaborate with the education care coordinator to create resources for ways to alter the classroom to best support children's needs, along with ordering additional sensory supplies and resources. I also got the opportunity to receive 20 hours of advanced trauma competent care training, followed by biweekly trauma competent care roundtables with staff. I was able to complete this with the goal of working toward becoming a certified TCC trainer myself. I also was able to present to staff, educating on the importance of using a neurobiologically informed approach to treatment that specifically targets the impact that trauma has had on their brain development. I also got to spend time researching and creating OT resources for staff and parents for continued use after my time there. I was able to learn through observation and participation in other aspects of the existing programming on site, such as situational counseling, the Juvenile Justice Initiative, in-school nurture groups, tutoring, play with the purpose, and more. Lastly, I got the opportunity to create a sensory pathway for the children to utilize between programming to assist in self-regulation. So this is a summary of what I was able to do during my doctoral capstone experience. Thank you for watching.